I am Sue Chapman. I'm always the optimist. I will not give up. I will not be defined. Oh, and she has Parkinson's. No, ma'am, never. Boxing, hiking, taking the grandkids on an adventure. I don't have to suffer, to have difficulty with walking. I don't have to have tremors. I can pick a glass of wine up. That's always my test, by the way, is to be able to pick up a glass and drink. When I first noticed it, I was actually working the legislature and I wasn't able to exercise as much. Maybe I didn't need to do more weights, less weights, walk more, bike more. I sat down one day at my desk and I couldn't type. I just could not get my fingers to hit the keys that I needed them to hit. I was frustrated. When Bill got there, this whole side of my body was in tremors and I couldn't stop it. Most patients that have Parkinson's will tell you the same thing I'm about to tell you. We have, many of us, been misdiagnosed, given the wrong medication, and that's what happened to me in Charleston.
I don't think that I'm an impactful physician if I cannot connect first and foremost with my patient, because I'm able to then better understand their needs and customize their therapy. When I'm first meeting somebody, I will tell them the most important thing today is for me to know your story. Because if I have that whole picture, we're gonna better treat the disease. It's not good enough to treat a symptom. If I only focus on the symptom, I'm missing the greater picture.
Oh my goodness, the first time I met Dr. Murray, she was very upbeat, she's very positive. She was probably the most attentive and listening to everything about me. When she got me on the right meds, I just felt like things were coming back again. But I had a lot of off times. So the medication, carbidopa, levodopa, you will have off times. I was on a pretty high dose and taking it pretty regularly.
We might be able to treat symptoms, but can we treat them consistently? The outcome is what drives our treatment. If those medicines aren't good enough, not giving the patient the quality of life they want, we want to really kind of think about additional options. And that's when we get into our comprehensive portfolio of tremor treatment, which includes brain therapy. Those brain therapies are things like deep brain stimulation surgery or focused ultrasound thalamotomy. No two patients need to be treated the exact same because their goals might be different, their tremor might be different. What we want to do is customize the therapy for that individual.
They turned on both sides December 29th of 21, and it was just like this. I'll never forget holding my hands out and just saying to them, look, I'm normal again. It may not be for everyone, but I know my husband and I, we would have gone to all lengths to do anything to help me with this. And I was just so blessed to have all those people involved, caring about me. I have no off times. When I get up in the morning, I get up and I'm going. I can just be me again. I feel so me again.
In all of medicine, you couldn't have a bigger instantaneous win than instantly modulating somebody's brain and giving them an instantaneous quality of life improvement. As soon as we flip that battery on, kind of if we're in the right zone, kind of the right area of the brain, the right kind of therapy, it will stop the tremor or significantly reduce it. Patients have trusted us to go through this journey. Brain therapy is a lot to think about, right? It's overwhelming. It's kind of unbelievable, quite frankly, for many people, kind of not as familiar with it as I am. And it's one of those things that I hope in time we get more and more comfortable with it, because I think its ability to really change people's lives and change people's quality of life, the sky's the limit.
See if you qualify, at least go that far. And if you don't, guess what? That team at WVU R&I, they're going to have a lot of other options for you. No looking back for Sue Chapman.